Hello, it's Peter B. Sims. Thank you so much for checking in. I wanted to share that we just completed some interesting research. We surveyed home health agency owners as well as executives related to DME. We're furthering our investigation on that industry. So if you're interested in learning more, come check out the data with me. Let's go. Okay, so we're back. This is the home health agency survey we recently conducted. Let's dive into the data, what we did and why we did it. We surveyed owners and executives from 15 Illinois-based home health agencies to understand behaviors, experiences, and practice patterns related to durable medical equipment and operational business decisions related to DME, supply, and demand. Upon analysis of this rich data, we learned some valuable insights and plan to share the findings in this deck. Let's learn more. Before we dig into the data, we would like to inform the audience that when we talk about DME, we're only talking about the following equipment: toilet assist, transport chairs, shower chairs, rollators, canes, walkers, and wheelchairs. This slide is made up of 3 questions. When we asked the home health agencies, has your agency ever received inquiries from individuals or organizations who have wanted to donate their unneeded DME? 33% of them said yes. When we asked the question, what have you traditionally done in this scenario? 100% of the home health agencies surveyed stated that they declined the DME. They did not accept it. Another question we asked the home health agencies was, how common has this type of inquiry been? 60% said once a year, 20% said once a quarter, 20% said once a week. When we asked the question, historically, approximately what percent of your agency's census has ordered DME during their home health episode? The home health agency surveyed said 52% of their agency census has ordered DME during their home health episode. This slide is made up of 1 question. We asked the home health agencies, does your agency have a DME lending closet? 10% of them said yes, they did, and 90% said no, they do not have DME lending closets. This slide is made up of 1 question. When we asked the question, how many DME providers does your agency use on a regular basis? 46% said 2. 23% said 3, 8% said 4, 8% said 1, and 15% said they were unsure. This slide is made up of 2 questions. When we asked the question, in relation to your current DME suppliers, is there anything you wished they would do better and/or different? 75% said the DME system is working fine. 25% said their DME supplier needed improvement. In the second question, we asked the home health agencies, how could they improve? Here are 3 comments made by home health agency owners or executives about their ideas on how they can improve. Make the documentation process less cumbersome. Also, time spent getting the items to the patients has risen. If they can't provide the needed DME, I would love it if they could just find us someone who can. So just like if we can't staff a referral, we send it out to another agency for the referral source. Ideally, the same process would happen with DME. Timeliness, delivery and setup with educational training, replacement if not working properly. This slide is made up of 1 question. When we asked the home health agencies the question, if your agency encountered a new company that provided affordable, high-quality, pre-owned DME, would you consider adding them to your list of suppliers? 100% of the home health agency executives and owners answered yes, they would. This slide is made up of 2 questions. When we asked the question, has your agency ever provided home health care services to persons who lacked or have had limited health insurance coverage? 79% stated yes, they had. 21% said no. Then we followed up and asked them the question, why did you feel compelled to spend your own money to help him or her? The responses from the home health agency owners and executives are the following. The patients needed the care. Medicaid was pending. Giving back. Our referral sources recommendation. our agency's mission? This slide is made up of one question. We asked the home health agency, in the past, thinking about the needed resources your home health patients lacked most often, please choose the one resource most lacking. 64% of the home health agency owners and executives stated that consistent family caregiver support and assistance was the resource patients most often lacked. Coming in second was transportation to come and go as needed at 15%, tied with 8%, the cognitive ability to live and function independently, assistive technology to promote participation, as well as improved quality of life. Coming in at 5%, the ability to effectively manage medications independently. Coming in at 0% was money to buy food, pay for housing, health insurance, medication, and transportation. Key takeaways. Home health agencies received inquiries about accepting unneeded DME. However, they chose to reject the equipment. Over 50% of home health agency patients have DME orders. 90% of home health agencies didn't have a DME lending closet. Over half of the home health agencies surveyed have used 2 local DME providers on a regular basis. 1 in 4 home health agencies wish their current DME providers would improve its services. Home health agencies are willing to start new relationships with companies that sell pre-owned DME. 3 in 4 home health agencies have provided pro bono care to home health patients. Consistent family caregiver support and assistance was ranked as the highest needed for home health patients. Thank you so much for listening to the results of the home health agency survey. And my name is Peter Sims. Let me know if you have any questions or comments, and let's stay connected. Enjoy the rest of your day. Peace.